Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I don't.
I've been a patient here for a long time. And I've discovered that I had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot. But I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
on the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, it's my legs. This is all like water. She said it's water.
It does look like water, tight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on. Yeah.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling.
Yeah.
So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing it. I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
I want to touch it before I buy it. Is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
That's all I've got really. The little things in life, which are the valuable things in life.
Precious.
Just take the dog for a walk on Wimbledon Common with the boy. There's lovely little precious things. But you can't do it if you're in agony. I don't have very long, and I don't know. I'm going through all kinds of negativities.
About the chemotherapy.
Yeah. Once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them.
What are you worried about? What worries you? The agony of
it. I know
the pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. But with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. I've been his sole carer for the last 16 years.
Right.
It's my son.
Yeah.
And I need to prepare him because he's acquired brain damage. He needs to be prepared for this one. We protected him when his mum had cancer, and she died, and he was in a mess. So now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah,
okay.
he's with guide dogs. He's got a guide. But
there's all that worrying you.
His welfare, his mental state, that's what worries me, yeah.
And what kind of support ideally do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
There's things I need to settle and take care of, yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, could you just give us a shout? and we can work it out.
Yeah.
I'll give you the amounts, more of these both.
Oh, the same again, yeah.
Yeah. I'll give you a bigger volume.
Yeah.
So that it doesn't run out.
Because I need to get this under control.
Yeah.
The management, pain management,
The pain we will get under control. The pain will get sorted.
Okay,
All right.
Thank you very much.
Nice to see you.
Thank you very much, Doctor.
Give me a shout if there's anything else.
Thank you very
All
much.
right.
Thank you.
Take care now. Cheers.
Bye.
Bye-bye.
Go on in. How's 2014 been treating you so far?
Well, in December, I spent 16 days in Lewisham Hospital,
Very sorry.
and now I'm on oxygen,
You're on oxygen at home now, are you?
16 hours a day.
So how are you finding that?
Oh, there's been lots of funny things happen. Your nose runs. Initially, it was bleeding. My throat's gone. No, it was not very funny, really.
No,
Not at all.
it's not a nice thing to happen.
What shocked me was they said I had pneumonia.
Well, yes.
And I'd come down with a cough, and I had pneumonia and a heart attack. But it was the breathing bit that got me, because I don't know what it's like to drown, but by golly, that was the impression I got on that Friday morning.
Yes.
I stood up, and all of a sudden I felt I was drowning because I was trying to grab air, and my hands would go in, trying to. It's frightening.
I think my biggest frustration is feeling that I can't help my patient because their problem is too complex. But the key thing that we do is we listen and we try to understand what problems that the patient is coming to us with, and we try to work with them to try and find the best solution.
The guy told me that half of the heart is not working, and it's not being able to pump the blood round, so it's the lungs are not functioning properly to do the job.
Well, look, put the jacket on. Let's have a listen to your chest and see what's happened. See what's going on. Deep breaths in and out for me, Brian. Good. Turn around for me. Let's have a listen at the back as well. Okay, deep breaths in and out. Good. Have a seat for me. Your chest sounds good. It sounds clear. You're getting lots of air in there, and so that sort of ties in. You can breathe. You're not feeling short of breath. That's all very positive. I imagine that the cause of a cough is the oxygen. It's drying things out and making you more likely to cough. I think the heart failure nurse is the right person to ask about getting reassessed to see if it's really needed or not, because it sounds like it may not necessarily be needed.
God, it's been a long 6 months, and I'm quite honest with you, it did bring me down.
Yeah.
And no one seemed to care anymore. I still don't, but what the hell? Anyway, doctor.
All right, Brian. Nice to see you. Take care. If you're having problems, call me, yeah? You don't have to always come down. Just give us a call.
You take care, mate. Bye-bye.
Bye-bye.
So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then,
Of course, yeah.
it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes so the worst they'd ever be? So I think it's a hereditary pattern.
Yes, it can
Rather
be.
than
Yeah.
it being dementia
Yeah.
or anything. And I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So I, probably because I don't want to go down the Parkinson's line, dementia line, I now put in a programme of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case it's, I'm pretending it's not Parkinson's, but then I read the paper today saying everybody's encouraged to go to their doctors and doctors get £50 for it. Oh, God, Yes, in the Times.
£55.
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination tests. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. Will you do it when you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good.
Oh.
Good. I want you to try and do that as quickly as you can. Quick, 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 quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done. Good effort. Okay, so if you could just write that underneath, that would be great. Thank you.
Far slower than I used to write.
Really? Yeah. Yeah. And this arm was tremoring as well.
Oh, was it?
It was when your hand.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is being such a capable lady to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
Right.
you would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank you.
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
it makes it a more enjoyable job.
Amanda, how are you?
Never say never.
What is it that I can do to help you today?
Right, well, I didn't realise I was low on my tablets as I thought I was.
Right, okay, so this is mainly a visit to grab some tablets. I'm very confused by your medication list, so I was just thinking maybe we should just quickly fire through it and try and figure out what you are taking and what you're not taking.
But I take all of it.
No, I know, but I think there's certain things on here which just... I just want to check. Make sure we're giving you the right things, right?
The amitriptyline apparently should be helping what I've got up going on the top of my neck, and I'm under the physio at Lewisham as well.
Good. How long have you been on the amlodipine for?
Quite a while now, because they've actually put me on another little one.
Is that the bisoprolol?
Yeah. And have they put the morphine on repeat as well?
Well...
Because I've been on it long enough now for it to be on repeat.
Well... The question is, do you want to be on morphine?
Well, no, I don't, but it does help with the pain.
Funnily enough, as a doctor and a GP, I don't want to give out medications to people. I only really want to use them when I absolutely have to.
My body's getting used to the 20/10, that's the only thing. And I know it can go up 2 more times, but I've got this big row with the job centre at the moment as well. They're trying to get me to go back to work, and if I don't find something or tell them that I want something, they're going to sanction me, which means I lose my money.
Right.
Which is not fair on me, because I know that I'm never going to work again. Because when my hands are bad, they're bad. It's enough to just try and make a cup of coffee, and then she sits there, but oh look, I burnt myself over the weekend. I said, we're not talking about you, we're talking about me.
Okay.
When I first had pneumonia years ago, but when I was about 40, I was working for Iceland. And I was in and out the van, and you put the big coat on, you get chilled because you're carrying all these heavy bags. So I'm sweat. Got pneumonia then.
Well, some people who though end up in those sort of situations, get
Yeah.
cold, etc., they don't get pneumonia. There must be something making you susceptible to pneumonia.
Well,
What do you suppose that is?
I haven't got a clue. You
Really?
tell me.
You don't. No
I'm
idea.
tired. I've only had 4 hours sleep. I had a bad night last night.
A lot of the problems that my patients have can be dealt with other things like exercise, diet, giving up smoking, not drinking so much. Those are the things which actually I need to be influencing and giving advice on in order to really improve the health of my patients.
How many are you smoking?
I've given up.
Have you given up?
Yeah. This might
I
smell of smoke.
I wasn't
because-
aware because last month I think we got you down there still smoking and.
No.
You
I
give
think
it-
I might have had the odd 1 or 2, but that's it. Because they kept saying to me in hospital, give up. I said, I've given up. What's wrong with you people?
Okay.
I've just done it pure willpower.
Good. We'll see what effect the tablets have had on you, but it needs to be 3 months down the line.
Right, okay.
All right, Amanda?
Thank you very much.
No problem, all the best.
Hello there. Nice to see you. Have a seat. Now, we've called you in for a global health assessment, I think, is something...
Well, yeah, I had to have a blood test.
Well, your blood pressure is certainly perfect. Your cholesterol is brilliant, so the tablets there are working very well. Kidney function's a little bit reduced from normal, but it's very stable. How have you been feeling in yourself?
Not all that, to be quite honest with you. Not all that. My legs play me up. And I do get a pain in the right-hand side here.
Yeah, that's to do with that arterial disease that we know you have. Do you mind if we just check your hips and legs out? If you pop in behind the curtain there for me. Just lie up on the couch and tell me about the dreaded cigarettes.
To be quite honest with you, I started again.
Right, well, that's a little bit of a problem. We know the circulation in your legs is not great. There's a bit of a pulsation here, and certainly none further down. I'm just going to rotate your hip a little bit. Just tell me if it's painful. Okay, well, they're both a little bit stiff, but the problem is still that circulation in your feet. Up you come. I think there's a good reason for asking a blood vessel specialist to have a look at you. I'll arrange a referral up at Queen Mary's and we'll get that done fairly quickly. Date of birth is 1st of May, 32.
That's it, yeah. 82 years of age.
So during the last month, do you feel down or hopeless, depressed,
Yeah,
frustrated?
yeah.
How big a problem does that get?
I just have to get on with it, don't I? You know, I used to go to my daughter's in Sussex, but I don't go now. But she phones me regularly.
Right. Does she come up here at all to see you?
Oh, yeah, but not like she used to.
No.
And I used to go down there quite a lot, but I feel I don't want to go now.
Yeah. And friends? Do you have any friends left of your age around?
No, not really, no. A few of the neighbours I get on with.
Yeah.
But other than that, no. Don't have no friends. No.
It strikes me that your legs are a big part of interfering with your life and making you a bit depressed, really. And if we get Queen Mary's to do an assessment, and I think that if we can make your legs better, I think it'll make a big difference to you.
Yeah.
Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
because
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah.
And if I press... Oh,
Yeah.
it's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
Oh, right across there. Pain is bad. I'm in a lot of pain.
I can see that.
Oh,
Where's that sore?
all across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting across
it's
here.
Pain at the front.
Yeah.
It's difficult for me sleeping and everything. Oh, and then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh. See, it's only that I sort of pulled myself up then.
And it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
Don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital.
No.
It's like it's more of like a rehabilitation type unit. Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because unfortunately she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some enquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some help.
help.
At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No, no.
So leave it with me. Am I able to get you on the phone later, John?
Yes,
Yeah.
you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement?
Got it. There we go. Okay. See you later. Okay, see you later. So how are you anyway?
I'm okay.
Okay. So last time I saw you, we checked your blood pressure and it was a little bit high, and then you very kindly went on to do some blood tests, didn't you? Okay. You look nervous.
I'm so sorry.
Why?
I try to overcome it without anyone knowing that I am very nervous, you know.
What are you nervous about?
I don't know really.
We're just feeling a bit anxious.
Yes, I am. And I know it's partly me, and I'm trying to sort of... Thank you for listening to me.
That's all right. That's what we're here for.
Thank you very much.
And we talked last time about your late husband as well, didn't we?
Yes. It's a lot of sorrow within me at the minute, you know. Although it's 4 years ago, and we had a wonderful time and everything. You know, I think he was told he had 6 months to live, you see, and it was devastating because we didn't realise that he'd got anything, you know, so dramatically wrong. He had pancreatic cancer.
Right. Okay.
And we were both kind of numb. The sadness of losing a second husband. The first husband, he went to work and died. I didn't get to him. I walked into the room and I said, I'm so glad I've arrived in time. No. Massive heart attack in King College Hospital. And that was shutting everything off, dealing with the children, you know, the heartbreak and not being able to cry at all, really. No tears. I'm talking now because I probably need to feel that I can have a little bit of help here from you know, and overcome it.
It's obvious it still plays on your mind, and it can be therapeutic talking to somebody.
Yes.
I mean, what do you think about having some counselling? Because we've got great counsellors here, and they could talk to you about your loss. I think it would be really helpful.
Yes. You know, the sadness and the overwhelming sadness. I'm going to cry in a minute.
Oh.
Sorry. No.
You can.
Sorry.
I think as a GP, we do have a very privileged position in that we learn a lot about patients that probably even their closest family members and friends don't really know, because it's often easier to tell somebody totally removed from the situation about what's going on. And to see what some people have to deal with in their lives is quite incredible at times. And if I can actually be a part of helping them through those difficult situations and see them on the other side, then it's incredibly rewarding. This is for you to fill in before you go and give it to the girl on the desk. It's about the counselling, OK?
Yes, thank you so much. I really appreciate it.
No problem.
How do I appreciate everything? You're very kind.
All right.
I don't know how to thank you.
Oh, anytime. See you later.
What can I do for you today?
Right, I don't know how it's happened, but I've cut myself underneath and my testicles are really, really swollen.
Okay.
Yeah, it's very, very uncomfortable. I sleep in the nod, yeah. I don't know, maybe there was something in the bed that I didn't realise was in there, I don't know, but it's very, really, really sore. The wife's obviously put some cream around there, but the pain's really, I can't bear the pain anymore.
Swollen and sore, and is the pain constant, or do you get sudden jolts of pain? Describe that to me.
Constant.
An aching pain?
I wouldn't say an aching pain. I feel that I'm going to pass out.
Tell me about when you go for a wee.
It's very uncomfortable when I go to the toilet.
Around your groin, or the testicles, or the penis?
No, the penis and the testicles.
And is it a burning?
It's like a burning pain, but a sharp pain. It's like someone's poking me with something.
All right. What we'll do is we'll examine you and get you to do a urine sample. Do you think you could go to the loo?
Yeah, of course I can.
All right. So, yeah, you are swollen, aren't you? Okay. I'm just going to lift up to see underneath. Where was the cut you saw?
Just right about here, I think it is. Yeah, right there. Ooh.
Let's get you seated again.
What do you think it is, Doctor?
I think there's probably an infection in your testicles. There's a little bit of blood in your urine, which might be an indicator of infection. So 2 weeks of antibiotics, then you'll see Dr. Ferdinand.
Right.
Obviously, if things get worse in the interim, come back sooner.
Yeah.
Once this infection has settled, we can bring you back and then have a proper examination to make sure there aren't any lumps and bumps that shouldn't be there.
Yeah.
OK, that's your prescription. So let's just see how you get on.
Yep, that's absolutely fine, Doctor.
OK.
OK then.
All
Thank you very much.
Mind how you go.
Cheers.
Bye-bye.